This is the PA Startup Podcast, episode number 13. This is the PA Startup Podcast, where we help pre-PA students, current PA students, and new grads start their careers as physician assistants. I'm your host, Chris Darst. We are glad you're here. Hey guys, welcome back to another episode of the PA Startup Podcast. Today's episode is the first of the Day in the Life series. I've been looking forward to this series because when I was a PA student, this is what I wanted to know. This is the bread and butter. This is kind of the goal. At the light at the end of the tunnel is, what is my life going to be like as a PA? And the great thing, as we've talked about in other episodes, is that the PA profession has just so many opportunities for people, whether it's the specialty or the hours that you work or the location where you work or working in a group or working independently. There's just so many opportunities that I want to share those with you somehow. So this episode is our first one. This is featuring a coworker of mine. His name is Eric Sprague. He is a PA with me, works in the same practice as I do with cardiothoracic surgery. I've got several others that are upcoming that are going to be, I hope, riveting for you to listen to, so you can know what your life would be like as a PA in different specialties. You can hear how they ended up there, what they've learned along the way, what advice they'd give themselves back at the end. So I hope you enjoy this conversation today. I'll be back at the end to fill in any gaps, and then of course you can hit up the show notes at pastartup.co/episode 13. Don't forget our podcast sponsor is audible.com. You can get a free 30-day trial, including a free book. If you go to pastartup.co/audible, you get one free download of an audiobook of your choice, and you can cancel anytime. Again, that is pastartup.co/audible. I hope you enjoy my conversation today with Eric Sprague, PAC, and his life as a cardiothoracic PA. All right, Eric, welcome to the podcast. How are you?
I'm well.
Have you been on a podcast before?
I haven't.
Are you excited to be on a podcast?
I'm thrilled.
So you are a cardiothoracic PA, is that correct?
Correct.
Poor you.
Yes.
No, it's all good. It's a good job. First, before we get started, do you have your phone on you?
I do.
Pull your phone out and you're going to send me a text message, and I want you to tell me what your top 3 emojis are. You've got an Android phone. Does it give you the most recents?
I do. No, it doesn't. But it shows me the ones that I use most commonly.
Okay, perfect.
I have a thumbs up, a middle finger, and a pound.
Hey, two out of the 3 of them are the same as Garner, who was on our first year out episode just recently. So nice work. I'm glad that there's some. I wonder what mine are. Let me look at mine.
Probably the same.
I bet it's like heart eyes, kissing faces. Hold on, let's look.
Kissing baby faces.
Kissing baby faces. Frequently used. I've got the thumbs up. I've got the crying, laughing face, and then the one where the teeth are showing, like the nervous face. That's usually when my wife asks me what, if I got all my chores done. I just send her that back. All right, man. So you've been out of school for how long?
6 years.
6 years. And how did you decide on the PA profession to begin with?
Right out of high school, I wasn't sure what I wanted to do, so I actually joined an asphalt company and did that for about a summer, and then realized that wasn't what I wanted to do for the rest of my life for obvious reasons. So then I still wasn't sure, but knew I needed to go to school, so I actually went to community college and took all the gen eds that I could for cheaper, and then I took half business classes and half health classes, and I did exceptionally well in my health classes and hated my business classes. So I then started to look into different fields of medicine, and really the biggest thing that helped me decide what to do was shadowing. I shadowed CRNAs, I shadowed doctors, I shadowed physician assistants, I shadowed perfusionists. And then after I spent enough time and kind of got an idea of what their life looked like and their work-life balance, I decided to pursue becoming a physician assistant.
That's cool. You shadowed a lot of people.
I did.
How did you get in touch with those people? Like, how did you find them?
Most of them were, I had a good friend who was a CRNA, so I talked to him and then used him as a resource to introduce me to other people, and then just kind of played my cards with people that I know from my surroundings or from school, and then had them get me in touch.
Sweet. Sounds good. So you got your prereqs done, applied to school.
Yep.
How did school compare to what you expected it to be? Did you know kind of what you're getting into, or was it a little bit blind? You just knew that you wanted to be a PA at the end?
It was a little bit more than what I had kind of anticipated. I knew the workload would be a lot, but as far as the amount of time studying and how much I needed to do outside of the classroom, I would say that was the biggest thing. Classes would last, till midday, and then you would have the rest of the day free. And now looking back, I understood why. But at first it was like, oh, well, I have a half a day off, so I'll do whatever I want. Instead, that should have been used to study.
So you're like doing yard work and running errands and stuff like that.
Yeah.
And you should be in the books.
Yes.
Yeah. I would take a lot of naps. I was physically in the library, but I was taking a lot of naps.
Yes.
So, very good. So what were your goals at graduation?
When I graduated, I wanted to have a job. I was newly married, and so, my biggest focus as I got closer to the end was find a job, and second, pass boards. The boards weighed heavily on my mind, and I wanted to make sure and sealed that up so I could pursue my career and get it started as soon as possible.
All right, so you got close to graduation. You're looking at the PANCE exam, nervous about that. When did you start the job search, do you think, in school? Can you remember?
Yeah, and I don't mean this to come across as arrogant, but during my rotations, and initially when I went into PA school, I loved sports, and so I wanted to do something in orthopedics. So during that rotation, I actually got offered a job, so that took a lot of the stress off, knowing that I already had a position waiting for me when I graduated. So my search for jobs wasn't your typical, where you have to apply and go through all that. It was kind of on the spot. But with that being said, looking back, one of the biggest regrets I have is that I was so consumed with getting a job that I accepted the first thing that was offered to me instead of really looking into it, meaning I didn't look into all the benefits as far as healthcare and 401ks and things that as a student looking to start your career, you kind of just blow by the small details. But really, when you start a family and want to look towards eventually retiring, those are things that matter now, that if you start at a young age, they accumulate with time, that I wish I would have known, when I first started and took that job right away without looking into the small details.
So that's great advice to look at the details and look a little bit closer at, what all does this job entail?
Yeah, that's exactly right. And to go on with that point is to always try and get something in writing if possible, because I accepted the job as a student just verbally, and some of the commitments that the doctor and I talked about ended up not being fulfilled, but it was my word versus the physician's word. So if you can, remember to protect yourself and get it in a legal document where you both sign it and understand the terms and conditions to what you're agreeing to.
That's too bad. So you were there, it was orthopedics, right? Orthopedic trauma?
Mm-hmm.
And you were there, what, 9
months?
9 months, okay. And then you got poached.
Yep.
We like good people around here. So when I remember talking to you on the phone, I mentioned this at the beginning, listeners, but Eric and I have worked together now for several years, but I remember calling him on the phone and telling him, hey, what do you think about cardiac surgery? Would you be interested in this? How did the job compare to what your expectations were? Like when you started thinking about the job, as you're working orthopedic trauma and now you've done the job, how do they differ?
With orthopedic trauma, I thought I would have a lot more independence, but what it came down to is I was a glorified retractor holder. During the cases, I found myself getting quite bored. There wasn't much use for me until it came time for closing. So I started to not feel like I was living up to my full potential as a physician assistant and what I could offer in the operating room. When I got called, that was one of the big factors that played a role in my decision to come over here, is I felt like I could do more and offer more, which is the case in the operating room. All the independence that we have was very refreshing for me, coming from not getting to do much to having a lot put on my shoulders.
Mm-hmm. Do you think that some of the responsibilities were because you were a new grad, or do you think that was how it was going to be, that you were always going to be the retractor holder?
I think that's in orthopedics, that's kind of how it was going to be, because I had a great teacher. She had been with the surgeon that hired me so he could have 2 PAs for over 5 years. And that's kind of what she had been doing throughout that time. Whether he let her do more because she had more experience, probably, yeah. But, to me, it didn't seem like there was a specific part of the surgery that was 100% dependent upon me. Mm-hmm. It was always dependent upon the surgeon and just helping with exposure, positioning, or holding a fracture in place while he plated it, or moving the kneecap to get the total knee in.
Yeah. So you came over to cardiac surgery, and tell me about what's a typical day like for you?
First thing we do in the morning is we go and say hi to our patients that are going to surgery, make sure they don't have any questions, concerns about what we're going to do. If it's a bypass case, we harvest the vein endoscopically, which is a great responsibility and brings a lot of fulfillment and challenges all at the same time. During the case, we first assist the surgeons with the bypasses or putting in the new valves or whatever it is. And then afterwards, the surgeon drops and leaves the responsibility of closing the chest on our shoulders, which again, if you think the longevity of someone's sternum and all the wear and tear it's going to go through after they leave the operating room, to be able to have that responsibility put on you to, I need to get this closed as perfectly as possible and make this incision look perfect, because the patient's going to judge their whole surgery that they can't see underneath the incision based on what they can see, which will be their scar. Mm-hmm. Was good. And it brought a lot of fulfillment and excitement, and each patient and each sternum and each leg or each valve is different. I remember my old boss in orthopedics was frustrated with me because he said, well, you're going to be doing the same thing every day. It's going to get boring. And I would argue that's quite opposite. Although it is a bypass every day or a valve every day, each heart is different and each patient is different, and it brings new challenges and new opportunities to grow and continue to learn and develop, which is very fulfilling in a work environment.
Yeah, for sure. What about outside the operating room?
Outside the operating room, we're in charge of rounding in the ICU, which again is scary at first when you are just learning the job and trying to learn all the drips and trying to learn when to give fluids and who needs their chest tubes pulled and who should stay in the ICU or who should be going to a step down. It can be overwhelming, but as you learn and progress and make mistakes, you start to become familiar with this is normal, this is not normal, and you get into a routine. And then each patient, you just do the same thing and just go down the list. And then once they're done in the ICU, you see them in the PCU, and then you dismiss them to home. But that doesn't end their story there. In a couple weeks, we get to see them in clinic. Now we've recently transitioned where the physician assistants are responsible for all the follow-ups in clinic, which is fun to be able to see a patient through as far as from the operating room to the ICU to the step-down unit to then when they see you in clinic and have come full circle to see, what you've done and how you've helped that patient is surreal.
Yeah. That's kind of nice closure, because a lot of surgical jobs, you might help with the surgery, but you don't do much clinic, or someone else is doing clinic. And so
Right.
you don't get to meet them first. You don't get to meet them afterwards. But yeah, we get a lot. It's a full spectrum of, we see them throughout the hospital and then see them in follow-up, stuff like that.
Yeah.
What's your favorite part of the job?
My favorite part of the job is the vein harvest. I love taking the vein and having the responsibility of giving a good conduit for the surgeon to use for the bypasses, and the difference that it's going to make in that patient's life. And like I said earlier, each leg is different. You could have 100 harvests under your belt and think that you're amazing, and then the next leg could easily humble you. So there's no room for pride, or there's always room for growth, no matter whether you're a first-time vein harvester or you've harvested hundreds of legs. They're each different with their own unique challenges, and there's always opportunity to grow and learn, and not only from an individual standpoint, but also, your peers, and learning the tricks of the trade that they've had success with, and bouncing off ideas. And that goes back to the original question of why I wanted to become a PA. Was I like the aspect of a team approach to medicine, whether it's with your own peers as physician assistants, or whether it's you and your doctor. It's not a one-man show. It's healthcare, and taking good care of your patients requires a team effort, and I think that's important to understand.
Yeah, definitely. And if that team is not functioning well, or if somebody's a weak link or something like that, it really throws things for a loop.
Yeah.
What's your least favorite part of the job?
When someone dies, you form the relationships with these patients and their family members, and they entrust their loved ones to you, but it's inevitable that sometimes things happen, and a patient passes, and you never forget the first person that you lose, and unfortunately, no matter how many people you save or make better, it's the ones that you lose that you remember the most, and it's a challenge to deal with the loss of a patient, and understanding that, yes, it is okay to show emotion, but at the same time, try and be a professional. It just takes time to learn how to properly grieve the loss of a patient, but stay professional at the same time. I would say by far that's the hardest aspect of this job.
Yeah. What was that first one like? I mean, you don't have to go into the details of what exactly happened, but were you prepared? I mean, you can never be really prepared, but did you think like this is inevitable, this is going to happen, or was this, I can't believe this is actually happening?
It was I can't believe this was actually happening. And to pop the balloon of excitement that I already had, it was actually my first successful harvest by myself, on a patient who we just done bypass on. He was doing fine, came off a pump fine, and then had an arrhythmia, and we coded for over an hour, and then he died and didn't even have a chance to leave the operating room. And I wasn't mentally prepared. I had never, seen that as far as from the cardiothoracic standpoint. I thought that we had just gave him some good bypasses, and he was going to go on with his life, and it was tough.
Yeah, that's no good. And whether that happens in the OR or in, up on the floor, it's never normal.
Right.
In a previous episode, I was talking to our other partner, Garner, where we talked about, finding your role, where in that situation, it might be crazy, it might be nuts, and you might be pulling your hair out, not knowing what to do. But if you find that one thing you could do, whether that's chest compressions or running to get equipment or something like that, that's how you kind of keep sane and then deal with grieving afterwards. Would you agree with that?
Yeah. In the moment, something overcomes you, and you just know, going back to the team aspect of medicine, each person has a role. Someone needs to be the captain, and then the other people need to do what that captain says. And then during the code, you do your best to keep your composure and to focus and to help this patient get through it. But, it's inevitable sometimes that you lose them. But once that's determined and the time of death is called, and things kind of go through it in your mind and figure out, what happened, or what could I have done differently, or what could we have done differently, and you learn from it. Each death should be reviewed, and as a team and as an individual, if there's something that could be done or something that could have been more efficient, or a code could have been called just a little bit sooner, or better chest compressions, or you name it, you can learn from it. It's not, you don't want to think that patient lost their life and that's it. If you can learn something from that death and apply it to the next code and save that patient, then that's a win.
Mm-hmm. I think the scariest ones are the ones that are unexpected.
Yes.
And it happens. And that's why there's a risk with every surgery. Even stuff that seems low risk, there's always a risk for something. Though there's like a subset of patients that we know something bad's going to happen to, or has a high likelihood of something bad going wrong. And then there's the other ones that you're like, they're healthy and they just need this little thing done. It's when those people have a problem that's like haunting. It's no good.
Mm-hmm.
So not necessarily a death story, but have you had any crazy encounters with patients? Like what's your funniest or craziest patient you've ever encountered?
When I was working in orthopedics, we had a patient who was a younger gentleman who was very sexually active. And unfortunately, after a major surgery, we walked into his room to round on him, my doctor and I, and he was doing the deed with his girlfriend.
In the hospital?
In the hospital. So,
so what was he, like a joint or a knee scope or what?
Yeah, he was a joint, and so he didn't need to be doing that. And to go on to that, it was funny in orthopedics. Every guy that we would do a joint on would want to know what sex position he could do, or when he could have sex, and how he could not dislocate his new hip. And so it was funny, all of the sexual teaching that I would have to do that I didn't expect from orthopedic surgery.
Wow.
That's just it was a whole new realm and just funny.
So it makes sense. I guess I expect guys to ask that question. What's the first thing the women would ask?
For total joints, it was not anything to do with sex. Most women were concerned of when their staples were going to come out, or how big their scar would be, and things along those lines.
It's interesting. That it reflects nature.
Right.
The guys are only worried about one thing.
Yes.
Man, us guys. What's wrong with us? Very good. All right. Well, one last question for you. What advice would you give yourself if you could go back and talk to the Eric at graduation, pull you aside for a second? What's the top piece or pieces of advice that you'd give yourself back then?
I would say to take your time when you accept a job, and to not just accept the first thing that's offered to you for fear of not getting a job, but to really realize that as a physician assistant that you have a lot to offer, and there is plenty of jobs out there, even though it seems in the local area to be saturated. Because our field is growing, there is a demand for us. So don't sell yourself short. Look at the little details, and if something doesn't seem right with your contract, don't be afraid to negotiate and have those skills to be able to say, well, actually, here's what this supports and here's what I want, and to be able to come to an agreement that is beneficial to you but also fair to your future employer. Cool.
Yeah. Don't be so eager to just take the first thing that comes.
Yeah.
I mean, unless it's great, then
right.
There's nothing wrong with taking it. But
for sure.
You're saying make sure that the details are spelled out and that you know what you're honestly getting into.
Yep. Just, protect yourself in the long run. It has to be what's right for you and your family, and, just look over the details. But if something does come and it's perfect and everything's spelled out and in writing and clear, go for it.
Sweet. Good. Awesome. Anything else you can think of that's pertinent?
No. Thanks for having me. This was good. A little weird at first, but good.
Yeah. It's all good. First time's always weird.
Yeah.
All right, man. Well, thanks for joining us today, and appreciate your time.
Mm-hmm.
That was my conversation with Eric Sprague. I hope you enjoyed that. He is a great cardiothoracic PA. He is a hard worker, great guy all around. He had some great teaching points in there of, not taking the first job right out of school, doing some shadowing to make sure that you know what you're getting into, and all that good stuff. So definitely check out the website, pastartup.co/episode 13. I'll put some show notes from today's conversation. Again, our Audible trial at pastartup.co/audible. That would be incredible. And definitely subscribe to the podcast. Leave a rating and review. Send any questions you might have for future question and answer episodes to questions@pastartup.co. You can leave a message on the website. However, my website's all messed up and it won't send your email, so I can't respond back for some reason. If you're a web designer and you know how to help me with that, that would be great. But otherwise, send those questions to questions@pastartup.co. And I look forward to talking to you in episode number 14. Have a great week, guys. We will see you next week. Seriously, I don't know if you can hear this dog in the background, but it is going bananas. And it's not even, it's my dog, but it's really my wife's dog. So I got to go let this thing out. I'll be right back.